we have a special guest here. It's Jelaine, our medical assistant. And so she's gonna kind of walk us through how everything feels, how it feels now, how the injection feels, how it feels afterwards. She's gonna do a day-to-day kind of update on how she feels and everything. So Jelaine, you wanna kind of talk about how this has been feeling for you?
So I've been putting this off for a while. So basically, like, the corner of my nail is obviously inflamed, and it's very, like, when I have shoes on and when I go running, it's very tender. So I knew it was time to get it done. So
how many years has it been?
Years?
Years?
Or no, just not years. No, just like a few months.
Few months.
Yeah,
okay.
not years.
And you've just been dreading it.
Yes,
okay.
I've been putting it off. So.
Okay, so we do the injections. I do 2 shots. I freeze it up real good, and then hopefully she doesn't feel this too much. We'll see. And here comes the shot. How you doing?
Fine.
How's it feel so far?
Okay.
You feel burning?
I feel a needle. Yep, burning. Okay.
All right,
That
that's
burns.
one.
Yep, that burns. Oh, that burns like fire.
And it burns for like 30 seconds after. Okay, we're gonna do the second one. Normally, it should feel a little bit better on the second one, okay? Okay. And stick. How's that feel?
Pressure.
Better than the first one?
No.
Okay. So Jelaine told me that she'll let me do her Ingrown blindfolded.
Oh.
She's not even listening. Okay. All right. Okay. So we're gonna let her know.
So I don't feel pain, but I can.
Yeah. Ready?
Like when you touch, like I can.
You can feel pressure, right?
Pressure.
Okay. All right. So we got everything nice and numbed up, and so she doesn't feel anything here outside of pressure, right, Jelaine?
Correct.
Okay. So I'm gonna get going. If you have any pain at all, let me know. Doing good?
I'm fine.
Okay.
Thank you.
Mm-hmm. How long did it take for that burning to go away?
It was only a few seconds, but it was intense.
Okay.
It's a little painful,
Mm-hmm.
but it's tolerable. I mean, if you can just kind of just bear down for like 30 seconds, and then it goes away. So
It all goes away. Okay, good.
yeah, if you can just kind of bear through it.
And now you're good, right?
Now
Nice and
I'm
comfortable?
good, yeah.
Good. So I try to take just what's necessary and not anything more. That way the nails still look. Here's her nail. We're gonna take that out. Let's see what she had hiding in there. Oh yeah, hold on. So she had all that hiding in there. And her nail kind of like flares out a little bit. I think that's why you're getting that anyway.
Yeah.
Okay. So now we put the chemical. And let's just extra skin right there. So this is sodium hydroxide, and it's the chemical that will keep that part of the nail from coming back. But it does kind of irritate the skin a little bit. So it'll get a little red and swollen around this area. And Jelaine will kind of, give us videos daily and show us what it looks like and how it feels and everything. Because it does, burn a little bit in the following days. So she'll tell you exactly how it feels, right?
Yes.
Okay, so once we're all done, then we put some vinegar on that area. That helps neutralize that chemical. And that is it. So we wrap it up and then we're all done.
Okay, so this is now 8 o'clock in the evening. I had the procedure done at 1 o'clock. I'm gonna take the bandage off, and then we're gonna soak it in some vinegar, warm water with vinegar. My toe is still numb, so that kind of shows you how long the numbing will last. About 2 hours after I had the procedure done, I did take 800 milligrams of ibuprofen, just because it did start kind of feeling a little throbby, but the ibuprofen knocked that out, and I was fine after that. And I have not had any pain this evening. There will be some blood, and that is normal. Okay, so here's my toe. I'm going to soak it for 10 minutes in some warm vinegar water, and then I will show you how we are going to bandage it up for the evening. Okay, so this is my toe after I soaked it. I have 0 pain, and like I said, it's still a little numb, but it's not terrible. So what I have is I've got my antibiotic ointment, my Band-Aids, and then a Q-tip. So what we're going to do is we're going to just put a little bit of this ointment on a Q-tip, put it right on the area. Use a Q-tip, don't use your bare fingers. It just helps eliminate, obviously, bacteria. You'll just put some Band-Aids on. One Band-Aid should do it. And that is how I will keep it for this evening. Usually in the evening, we keep it wrapped during the day, and in the evening we leave it open to air. But this evening I am gonna keep it wrapped, and then from here on out, I'll wrap it during the day and in the evening. Okay, this is the day after my Ingrown procedure. As you can see, there is some drainage on my Band-Aid. That is completely normal. And I do have, I don't have any pain. So that's what it looks like. Like I said, a little bit of bleeding, a little bit of drainage, a little bit of redness is normal. If I had red streaks going up my toe, or if it was like a dark, deep red, then there is some concern there. But a little bit of redness, a little bit of drainage is normal for up to 2 weeks. So all you have to do is just keep it clean, which I am going to kind of just lightly clean it off right now. You keep it clean. I'm going to apply more ointment and another Band-Aid, and that is all I'm going to do for the next 2 weeks. This is day 5 after my ingrown toenail procedure. I've been at work all day. I do wear normal enclosed shoes. I still have zero pain. So all I do during the day is just an ointment and a Band-Aid. So obviously it's still a little red and draining. For 2 weeks, that is normal. This redness, the drainage is normal. If, like I said, if I had red streaks or if it was like a pussy drainage, then that's when you need to call with some concern. But this is kind of like a clear drainage and just a little mild redness from the acid treatment. We do not recommend using any peroxide, any alcohol. It's basically soap and water, pat it dry, ointment and a Band-Aid, and at night leave it open to the air. I do not have any pain, and I'm able to work and wear shoes and go on my evening walks, and that is day 5.
This is how it looks. This is actually how it normally looks. So you get a little bit of redness here, you get a little bit of drainage there, but that's it. So how does it feel today?
It's fine, no pain.
No pain?
No.
Awesome. So this is kind of what you would expect 1 week out. We're gonna do one more video at 2 weeks out.
This is day 8 of my ingrown toenail procedure. It is starting to scab up. The redness is going down. And this is day 8. We're off.
Hey guys, so we are here for our final follow-up. This is 2 weeks after the procedure. Jelaine says she felt great. No real problems with it.
No.
Any regrets?
No. I highly recommend getting it done if you need it done.
So first day you had pain, and
first
then after
day,
that?
yes. First day was tender. After that, it was fine. I just did ointment and a Band-Aid for 2 weeks, soaked it a few times, and that was it.
Perfect. So I always bring the patients back. I clean up the scab a little bit, let it drain off anything else that it needs to drain off, and then that'll be it. So I'm gonna clean up this scab. It'll look a lot nicer after we do this part. This doesn't hurt usually, so if it does, let me know. So we'll clean all that up. Looks like it's nice and healed on that side. And that is it.